Hey, good afternoon there, Envision Physician Services. This is Josh Rose, American Medical Response's National Director of Innovative Practices, coming to you from Pensacola, Florida. Unfortunately, I was really looking forward to being there with you in person today, but Delta Airlines had other plans for me this morning, and I'm stuck back here. In any event, I always used to like it when the teacher would show a movie right after lunch, so hopefully we can still make this work for you. So, today I'm going to talk about the single most important issue in the minds of your healthcare system customers: driving margin. Specifically, how American Medical Response and our medical transportation services can help healthcare system leaders improve their bottom line. Now, let's be honest, it doesn't matter if you're speaking with a large or small system, urban or rural, for profit or not for profit. A healthy P&L is the lifeblood of modern healthcare. And for many system leaders, they think about it in reverse. They know that without a strong margin, they can't fulfill their mission. So, what does this require? Maintaining a strong, healthy P&L margin for a healthcare system. Well, it's not rocket science. As you guys know, healthcare systems can improve their bottom line really through two different mechanisms. They can increase top-line revenue by providing more services for more patients, and they can cut the expenses associated with providing those services. Now, fortunately, there are patient transportation solutions from American Medical Response that can help do both. So let's start by talking about patient flow. Now, you guys literally wrote the book on patient flow, so I don't need to tell you how important it is to move patients effectively through a healthcare system. But as much as I enjoyed reading that book, it forgot about one important detail. It was really focused on what happens within the brick and mortar walls of the hospital, and it didn't discuss in great detail about how to move patients effectively into the system or back out. So that's kind of like a plumber putting pipes into your house, but not connecting them to the water or sewer lines out in the street. No matter how well you circulate that stuff, eventually it will back up and start to stink. The same thing happens in your hospitals. If you don't have an aligned patient transportation strategy to clear beds off the floors on the back end, then backups will start to occur in your emergency departments. Not having a solid transportation provider can also create challenges with leakage and patient satisfaction as well. Too often we see situations where the local discount ambulance provider just wants to complete the shortest trip, or where there's no continuity of care between the treating facilities and the transport team. Not only does this result in lost patient service revenue, it can create bad patient satisfaction scores for the entire system. Now, medical transportation is the fuel that powers the patient flow engine. An aligned transport strategy effectively moves patients from the community into the healthcare system, from local hospitals to regional hubs, and then from the hospital to subacute, long-term, or rehab care, clearing beds to make room for the next patient. You see, an aligned transportation strategy will staff resources based on the system's need, so patients can be moved around effectively on demand. It also can embed dispatchers into bed control points and transfer centers to eliminate leakage, and it helps improve patient satisfaction through coordinated care during the transport. Now, what's more, when AMR partners with a healthcare system, we can do creative things to help extend their message, like wrapped and branded units, and expand their catchment area with dedicated transport teams for NICU or PICU patients and other complex patient referrals. We can even help improve community access to the healthcare system through partnerships and rideshare services like Lyft, our internal or external air ambulance partners, or even some very creative behavioral health transport tools. By improving the community's access to care, we can extend the healthcare system's reach so they can provide more services to more patients. All of these solutions help increase the flow of patients from the community into a healthcare system and improve the top-line revenue potential, that first part of growing margin. So let's talk about the costs of healthcare transport and what American Medical Response can do to help manage expenses for healthcare systems. I like to bucket these into three groups: direct, indirect, and self-inflicted. I'll explain what I mean. Let's start with direct. The first most obvious cost associated with medical transportation is the actual cost of transport. Nationally, non-emergent interfacility ambulance transportation, moving patients between hospitals and other facilities, costs approximately $8.1 billion a year. Now look, in the grand scheme of healthcare costs, we know that $8.1 billion is pocket change. But for individual healthcare systems, those costs can really hurt a bottom line. Now, the good news for most hospitals is that the majority of the costs of medical transport are really the responsibility of third-party payers. The bad news for healthcare systems, however, is that the rules around some patients are pretty clear. If the transport is related to a Part A DRG stay, the system is financially responsible. So all those systems that are trying to control costs by consolidating certain services like imaging or surgery into a single facility now have to deal with the expense of moving patients back and forth to get that service. And these expenses can add up. It's not uncommon for an individual system to be paying north of $100,000 a year for medical transportation, sometimes a lot more. Now, the good news is that American Medical Response has a number of strategies to help control those costs in a system-friendly yet fully compliant way. We are the only medical transportation provider with relationships with group purchasing organizations like Health Trust. The GPO relationships help guarantee favorable pricing and rebate structures, which could save individual hospitals thousands of dollars. We can also build creative pricing models, such as leased unit hours or capitated arrangements, which reduce the overall cost of service for larger healthcare systems that have significant transport needs. So let's talk about the indirect costs of medical transportation. Now, these are much harder to quantify, but no less significant, and for many healthcare systems, probably much more expensive than the individual trips themselves. For example, let's start by talking about the ordering process. Have any of you ever asked a hospital case manager or discharge planner about the most time-consuming part of her day? I'd bet more than half would tell you it's the process of securing transport for a discharged patient. You see, it's not just the initial phone call to an ambulance provider, which really could take up to 10 minutes for complex patients, but it's also all the associated paperwork and follow-up calls that can take a lot of time. One healthcare system we spoke with told us it took an average of 21 minutes per patient to book transport. So if a typical 5-hospital system transports 20,000 patients a year, that's almost 3.5 full-time employees purely dedicated to booking ambulance trips. Well, AMR listened and has a solution to help. We've created a proprietary, integrated online ordering solution that can book transports at the right level of service and complete all the necessary paperwork with clicks, not calls, and cut the ordering process to under 5 minutes. So that same healthcare system I was telling you about before installed it, and they were able to reduce their ordering time by 70%, letting case managers spend more time with their patients while taking larger case loads. This reduced overall staff expenses for the system while improving care for their patients. So that brings us to the third bucket, and the most expensive: self-inflicted costs. Now, this is what I call the costs healthcare systems generate related to medical transportation that are really just the results of bad decisions and completely avoidable. I'll give you 2 examples. First, how many of you have seen healthcare systems try to own and operate their own ambulance programs? Collectively across the country, there are somewhere between 800 and 1,000 hospital-owned and operated ambulance services. But here's the thing. I can count on one hand those that are actually making money for their system, and I doubt I'd have to take off my socks and shoes if I wanted to include the ones that are just even breaking even. Now, this is because, as you know, medical transportation is a high-volume, low-margin service. Successful medical transportation services, like AMR, are powered by scale. No individual healthcare system is going to be able to generate the scale necessary to cover those costs. Now, that's not to say those 1,000 hospitals are stupid. There are lots of positive benefits from having a hospital-based ambulance system, but there are better ways to do it than trying to own and operate it yourself and carrying 100% of that loss. For example, AMR routinely partners with hospitals to share the expenses of maintaining a healthcare ambulance system. We also actively pursue acquisition opportunities, joint venture partnerships, and management agreements where we can help hospitals avoid the cost of an ambulance program by folding their fleet into the AMR family. The best part of these systems, they can still look and feel like they're part of the hospital, just powered by AMR. So here's a second example of a self-inflicted bad decision that led to big costs. Now, I'm sure you're familiar with HCA Gulf Coast. Did you see the headlines that came out a couple weeks ago? 4 HCA Houston area hospitals agreed to pay $8.6 million to settle allegations related to the anti-kickback statute, specifically related to ambulance transportation. You see, apparently there are some ambulance companies out there willing to provide heavily discounted Part A trips for hospitals in exchange for all of the hospital's Part B work, which they charge to Medicare at the full rate. The government considers this a kickback. Previously, the OIG only went after ambulance companies, but they've now started to investigate the hospitals themselves. HCA Gulf Coast is just the first to fall, but you can bet there will be more. Now, the good news is that this is completely avoidable when healthcare systems partner with a company like AMR. As the largest provider of ambulance services, we obviously have the most to lose and are always under a microscope. As a result, we have extensive compliance programs in place to protect ourselves and our customers, specifically to avoid these types of issues. So you can see that American medical response is really a lot more than just moving patients from point A to point B. We help healthcare systems improve their opportunities to earn new revenue and reduce the operating costs associated with that revenue to improve their bottom line performance. So, at this point, the question you're all asking yourself now is, what's in it for me? Why should I go out of my way to refer one of my healthcare system contacts to AMR, especially when, let's face it, in a couple of months, we're no longer going to be part of the same family? The answer is simple: street cred. You want your customers to know that you're the person who can solve their problems. So when you see a healthcare system struggling to maintain a strong bottom line, you can ask if they have a comprehensive medical transportation strategy to help grow that margin. Remember, margin matters. So if they're not able to meet their needs when it relates to medical transportation, have them give us a call. I bet we can find a solution to help. So, thank you very much for paying attention. Look forward to answering your questions. And again, I apologize for not being there in person today, but you can always reach me at joshua.rose@amr.net. I look forward to hearing from you. Thanks so much. Have a great day.